A car accident, a heart attack, a stroke, a medical emergency. When you're fighting for your life, time matters, and so does the team transporting you. For decades, Northwest MedStar has been saving lives by saving time. We're in the air and on the ground because you never know when the unexpected will happen. Northwest MedStar operates a state-of-the-art fleet from regional bases throughout the inland Northwest to provide extraordinary care to patients in Washington, Idaho, Oregon, and Montana. We bring the ICU to you.
If I could say there's been one great, significantly different and major contribution to the health and welfare of everyone who lives in the inland Northwest, it's been the development of this transport team.
Northwest MedStar works closely with EMS first responders and healthcare professionals throughout the region, all with one goal in mind: saving lives.
We go to ski accidents, motor vehicle crashes. Often we go to small rural hospitals and pick up the patients and bring them to the larger hospitals. During that time, I give critical care nursing.
Emergencies come in all shapes and sizes and at all sorts of locations.
I fly on all the flights, adult, pediatric, neonatal, and maternal, as a respiratory therapist. I have transported patients on snowmobiles. As you get out there with the helicopter and you land, and sometimes you have to go up to where the patient is, sometimes you hike in and carry him back out, or whatever it takes to get back to where they're at.
No matter what the issue, you want the best team seeing you through it. Every Northwest MedStar patient experiences the same level of care and expertise they would in an intensive care unit, with a registered nurse and a registered respiratory therapist on every flight. For the tiniest of patients, we have specialty flight teams, including pediatric, high-risk obstetric, and neonatal specialists. Our team is highly trained with emergency room and ICU experience.
The cases that they handle are at the high end of tough, and the care they provide is at the very high end of wonderful.
Our fleet consists of multiple helicopters, fixed-wing airplanes, and ground ambulances that transport patients from accident scenes and rural hospitals to specialist teams at urban hospitals. Our aircraft and ground transportation vehicles are efficient to operate and employ the latest technology to support pilot and crew decision-making and safety. We rely on night vision goggles and other safety equipment to provide the best care no matter the time of day, weather conditions, or type of emergency. Our communication center is the heart of Northwest MedStar, and unlike most, is staffed by both certified flight communicators and registered nurses. This means the team in the air and on the ground are supported by medical professionals from the minute Northwest MedStar gets the first call to the time the crew returns from the field. The communication center is in constant contact with physicians, hospitals, and the flight team while coordinating the entire process.
Lincoln County is the area that we serve, and it is a frontier community. So we take care of a large geographic area and a few people in there. Our challenge is being able to deliver care over that large geography. And so in delivering care, partnerships like our partnership with Northwest MedStar is very important. We feel very comfortable being able to turn over the patient to the respiratory therapist, the registered nurse, in order to get them where they need to go and care for them in transit. So this relationship is very valuable to us.
We found that MedStar's ETA to the scene has always been very accurate. We can count on them to be there when they say they will. They've done so many of these flights over the years that they pretty much have it down to a science, where when they say they'll be there in 10 minutes, they'll be there in 10 minutes.
Northwest MedStar's commitment to sharing our expertise with emergency medical service first responders, hospital personnel, healthcare providers, and law enforcement is unmatched. Northwest MedStar promotes collaboration and education throughout the Northwest. We work alongside the medical community to establish time-saving protocols for cardiac and stroke emergencies too. Northwest MedStar works to reach community members with information about air ambulance services by attending health fairs and community events. We offer memberships to shield patients from the out-of-pocket costs associated with air transport. Membership provides a family the peace of mind knowing that whatever their insurance won't cover, their membership will.
If we hadn't have had the Northwest MedStar membership, the transportation costs would have been around $30,000.
The single greatest variable in a healthcare emergency is time.
In a heart attack, time is muscle. The faster we can get someone to the cath lab, the better their outcome. And with the goal of minimizing the transport time, Northwest MedStar plays a big part in that.
Your Northwest MedStar team is ready and waiting to act quickly and safely to get patients the specialized care when and where they need it.
When that helicopter is in the air, people look up and they see it coming into our community, and they know that the people in Spokane care about us and they're here to help us. And so it's an icon for all of the specialists, all of the emergency services, all the trauma, the care that's there, and it's a real reminder to everybody that we're part of a bigger system.
With specialized critical care teams and innovative technologies, Northwest MedStar is an essential part of the region's healthcare system. Northwest MedStar is just one more service of Inland Northwest Health Services, doing whatever it takes to improve healthcare. Learn more online at nwmedstar.org.